Countryside Veterinary Clinic, and I'm here to help you understand more about dog nutrition to make your choices easier when you try to pick out the perfect dog food for your dog. I have a helper here, Lexi, and she's going to ask for you the frequently asked questions that we get when we're doing exams here at Countryside Veterinary Clinic.
Dr. Saverns, what are the life stages of feeding my dog?
We break the life stages down of a dog into three important categories. First, we have the puppy lifestyle. When the puppies are rapidly growing, their energy needs are very high, so those foods are going to be higher in protein and higher in carbohydrates. We have our middle-aged dogs that are not growing anymore. They generally don't have any disease states going on, and that's just the regular age group that's just called adult. And then we have the senior foods. The senior foods are when animals are older. Animals reach senior at different ages based on the breed and the size of the animal. For instance, a Great Dane may be considered elderly at 6 or 7, and a little tiny poodle may be considered elderly more when they're 12 and older. But these foods are lower in protein. They usually have joint supplements in there as well. They may be lower in phosphorus and calcium. And so you can see that we would not recommend a food that's called all life stages, because it would be over protein and calcium for an older dog, and if you fed the puppy the older food, it would not have enough calories and proteins for their needs. So there's 3 different life stages.
Should I feed my dog on a schedule? How do I know if my dog's nutrition is suffering?
We recommend feeding particularly puppies on a schedule. You can monitor how much they eat. You can make sure that they don't play hard and fall asleep and then forget to have lunch. So we recommend that they have a breakfast, a lunch, and a dinner. And then the other thing about that is it's a little easier, to get them housebroken if they are on a schedule, and then they'll be more successful. When dogs are older and we're not trying to get them housebroken, it is okay to leave food down for them all day long if they're a dog food that just likes to nibble here and there. The dogs that are gobblers and are going to eat all of their food immediately, then I think they definitely need to be fed specific meals. And sometimes our overweight dogs, we need to feed them specific meals so they do not get too many calories in a day. How would you know if they were suffering? Weight loss, weight gain, maybe lethargy, they don't have a lot of energy, but I would hope that you would go to a veterinarian for the reason that they were not doing well, and then we can discover whether or not there's a nutritional need or a different type of problem going on.
And how do I know if I'm feeding my dog too much?
Well, we ask you to feel along the ribs. You should always be able to just gently feel their ribs. A dog at the top, if you look straight down from the top, should be rounded. They shouldn't be squared off. And if you look at a dog from the side, their tummy should go up, be tucked up a little bit. They shouldn't just sag down. So those are some things, and you can always ask us as veterinarians. We'll give you a good opinion too.
And what are the essential nutrients that my dog needs?
All dogs need proteins, carbohydrates, vitamins and minerals, and fats in their diet.
How will a veterinarian be able to assess if my dog is getting proper nutrition?
That's one of the reasons we recommend that all of your dogs have a physical exam once a year. It's a good time to talk about their weight, look at their teeth, listen to their heart and lungs, check their hair coat, their mucous membrane color, the shininess of their eyes, and ask you a lot of questions about their behavior. Sometimes if there is a problem that may be related to nutrition, other times it could be a different disease, but it's a great time to discuss that and then actually talk about the different lifestyles that your dog is in and be able to make those changes as they get older.
There are so many different brands of dog food. How will I know which one is best for my dog?
It's very confusing out there right now, we know. The first thing we think you should do is rely on a specific source for your information. Veterinarians are great sources of information. We follow nutrition, and we have specialists that we can always talk to about nutrition. The second thing is find a company that you believe in. And here at Countryside, we love to talk about nutrition and promote good nutrition for all pets. Some of our favorite companies is this Purina company. Also, Science Diet, Hills, they make excellent dog foods, and Royal Canin is another one of our favorites. All of those food companies, they have nutritionists and toxicologists on board. At any time we can call them and ask them questions about specific needs for a specific patient. They do food trials so that when they formulate a food, they make sure they feed it to the dogs and they get the outcome that they're expecting. So talk to a trusted source, and then let's trust different companies that we know that we can count on.
And when would my dog need a prescription diet?
There are many times in a dog's life that they may need a prescription diet. For instance, a diabetic dog might need a food that is higher in protein and less in carbohydrates. We may find a dog, Purina makes a product called EN. The EN is a diet specific for dogs that have gastrointestinal problems, vomiting, diarrhea. It's easy to digest. Some dogs, when they're older and their kidneys are not working as well as they should, they may need a special diet. So going to the veterinarian regularly, also using your instincts about your own animal's behavior, anything that would cause you to wonder if there is a problem with your dog would be a good time to go to the veterinarian. And if nutrition is part of the answer, then that's what you need to do, is go on a prescription diet.
And if you have any questions regarding dog nutrition, you can give us a call at 410-461-2400. We want to help you put your dog on the path to a long and healthy life.
Thank you very much. Bye-bye.